Thank you for joining us. Today we're at the St. Elizabeth Training and Education Center in Northern Kentucky, and we're going to talk about a relatively new procedure called cervical disc replacement. Before I introduce our guests, I'd like to remind viewers to submit any questions you may have in the comments section, and we will answer those throughout the broadcast. So I'd like to introduce Dr. John Jacquemin with OrthoSensi, Orthopedics and Sports Medicine. And Dr. Jacquemin, if you could just tell us briefly your specialty and what you do as an orthopedic surgeon.
Sure. So I am an orthopedic spine surgeon, which means I've gone through medical school and then residency for orthopedics and then additional training in spinal surgery. So I take care of people that have bad necks and bad backs.
Okay. And joining us also is someone who has recently had this procedure, Laura Rolling, and if you can just introduce yourself too.
My name is Laura Rolling, and I had the surgery about 2 years ago. Actually, it was 2 years ago, April, and Dr. Jacquemin was fantastic, back to normal.
And we will hear more of Laura's story later on, but I think for right now, let's go ahead and find out a little bit more about this procedure. So Dr. Jacquemin, if you could just tell us what actually is cervical replacement?
So cervical replacement is very much like a knee replacement in that a patient's knee becomes arthritic and doesn't want to move very well or becomes very painful, and orthopedic surgeons can take that knee out and basically put a new knee in. The artificial disc is similar in that respect. Taking an old disc out or a worn out disc out, putting a new disc made out of metal or plastic in there to
And what are some of the benefits?
The biggest benefit of the procedure is that it allows for motion. Most current studies have shown that in terms of pain relief due to the problem of disc replacement, the artificial disc and tricuspid fusion are very similar and successful. The advantage of the artificial disc, though, is that because it allows things to continue to move, that other levels do not see as much pain. And the way I explain that to patients is that if you're a kid and you left your bicycle outside or the chain rattles, as the chain would go around the sprocket, some of the links wouldn't move at all. Other links would move twice as much to keep the chain on the sprocket. They'd be moving with the growth. And then those links you would think would start to wear out because they're moving more. So in a similar fashion, when you use part of things, other levels of the neck try to make up for it, but unfortunately that can make them wear out faster.
Okay, and you've alluded to some of this, but from a surgeon's perspective, could you elaborate more on some of the benefits?
So the biggest benefit I find the patients are two. One is that it allows for that motion, which down the road will be helpful to people. So 5 or 10 years down the road, they're not getting as many degenerative changes or other problems in their neck. The other issue is that with an artificial disc, we're not waiting for the bone to fuse. So we can allow people to go back to activity in about half the time as compared to having a fusion done.
Okay. And does this procedure replace any other type of surgeries?
It does. It stands alongside having what's called an anterior cervical discectomy and fusion, so an ACDF. It's a very common spinal procedure. Anterior means front, cervical is in your cervical spine or your neck, and discectomy means removing that disc from the front side and removing any pinching of the nerve from the front side. And then fusion, which is locking those two bones together. So artificial disc replacement is an adjunct to that. It stands right next to it. You can do one or do the other. And there are certain clinical conditions where it's better to do a fusion than it is to put an artificial disc. And so it doesn't necessarily take the place of anybody ever having a fusion again.
Okay, well now that you brought up fusion, I'm going to ask a question that we have some video with. Is this a better option than spinal fusion?
I think for the right patient, it's a much better option. So for people, it's less common to have disc herniations in your 20s and 30s and into your 40s, but the artificial disc in those patients allows things to continue to move so they don't get as many wear and tear problems down the road. As we get into our 60s and 70s, people begin to have disc herniations, but they're also having quite a bit of arthritic change in your neck. And so for those patients, you don't want to do something that encourages the motion. You want to tend to lock things in place.
Okay, and we have another video. Could you talk about the differences between spinal fusion and cervical disc replacement?
So both procedures are very similar in that they initially start out the same. We make an incision on your neck, we remove the disc and any bone spurs that are pinching the nerves. Basically, we make more room for the nerves and for your spinal cord. So to that extent, the procedures are exactly the same. The next part comes, though, if we're planning on doing a fusion, you then size that space where the disc came out, and you place a piece of bone or a little device called a cage in there that's filled with bone, and cover that with a metal plate and screws. And that basically bolts those two bones together and allows them to heal. With an artificial disc, when you get to that point where everything's been cleaned out, you then put in the appropriate size artificial disc and position it appropriately within the disc space so that the spine is able to balance on top of that, and then allow you to twist and turn your head and bend it forwards and backwards.
Okay. Could you describe some of the common conditions that might bring someone to see you for this?
So the most common condition is to have a herniated disc. And there are big discs and small discs, and there are discs that come out the sides and discs that come out straight out the back. They come in all different kinds of shapes and sizes. And depending on the person and on the size of that disc and where it's at, may give people different types of pain. Either pure neck pain, or more commonly patients have pain that travels down into their arms or down in the back, down to maybe the bottom of their shoulder blades. The patients can also have just simple arthritis in the back of their neck, which tends to give you more pain down in the back of your neck rather than giving you any pain down into the arms. Those are really the biggest issues that we see.
Okay. We have another video. Could you describe exactly what happens during the surgery?
So the surgery starts out with you coming to the operating room and going to sleep, and you're lying on your back. You're covered with pads and you're under a nice heating blanket, so you're taking a nice nap for a couple hours. While we're there, we have a technician apply little needles basically all up and down your arms and legs and in the back of your neck and in the back of your head, and those hook up to a computer in the side of the room, and that technician watches that computer and is able to watch your nerves and your spinal cord throughout the case. So patients are always worried, can I become paralyzed by this surgery? The technical answer is if someone's operating on your neck, then the technical answer has to be yes, you could become paralyzed. Now, the next question is, have you ever had someone become paralyzed after a neck surgery? And the answer is no. That is extraordinarily uncommon, not just for me, but anybody in the Cincinnati area and really the whole country. And they can watch those nerves with this computer, and we know if there's any problems going on. The next thing we do is we make a small incision about 2 inches, and where I make my incisions on the front of your neck and on the side, and believe it or not, we all have skin folds, and we hide it in those little skin folds. So that at the end of the case, the stitches are all under the skin, and they're hidden in that skin fold, so you really can't see it later on. They go after about 2 months, they're hard to find. Once we're inside your neck, all this stuff up in front moves around. So we're able to push your esophagus and your trachea off to the side, and really your spine is right there behind those guys. It's much more in front than you think it might be. We're able to then get down to where the bones are and then start removing the disc that's giving you trouble. And we use x-ray machines to help us and point us in the right direction in terms of removing which disc and how far, etc. But we take that disc and any pieces completely out, so when it's all gone, we're looking at the nerves and we're looking at your spinal cord, and we know that there's nothing pinching those guys anymore. We then have to make a decision based on some of the anatomy and some of the preoperative factors about whether you then go on to have the fusion done or whether we put in the artificial disc. At the end, when we're all done, everything really slides back right into place, and we're able to, again, stitch you up with stitches under the skin, and you wake up in the recovery room. Okay. Altogether about 2 to 3 hours, depending on how much work we have to do.
Well, I was just going to ask that, from what you described, how long does a typical procedure take?
Anywhere from 2 to 3 hours. You know, it tends to take longer if we have to do more than one spot in your neck, or the bigger your neck is, the more work it takes for us to get down in there and get things taken care of.
And you said it's a small incision that you hide in
yes.
some of our fat folds?
I never said that. Yeah, you know, we hide it in your skin folds later, so that later on you really can't see the incisions. They're actually fairly nice cosmetically.
Okay.
And you know, we typically don't. We get very few complaints about the scars afterwards.
All right. I do want to remind viewers that if you have any questions, feel free to submit them to the comments section, and we will answer them either during this broadcast or later on today. At this point, could you talk about what happens after the surgery?
So after surgery, immediately afterwards, patients wake up in the recovery room, and they spend about an hour and a half or 2 hours in the recovery room. And then, depending on the patient and how much work we've had to do, they may be able to go home that same day, or they may need to spend the night in the hospital. Okay. If you do go home, you're basically going home with light activity and just taking it easy around the house. We don't want you doing a lot of bending or lifting or twisting kind of activity. If you spend the night in the hospital, it's basically just to keep an eye on you and your breathing and pain control overnight. And then we send you home basically the next day with the same instructions. You know, just no heavy lifting, nothing real strenuous for about 2 weeks. Usually you take a break from driving the car for about a week, and you can do light things like grocery shop, but not pick up big heavy bags of dog food and things like that. We just don't want you doing anything real strenuous for a while. After about 2 weeks, we see you back in the office again to check on your incision and check on how you're doing, and then we'll take x-rays that day to just make sure the placement of everything. We want to make sure it's in the same spot where we left it when we were done in the operating room. At that visit, we'll then also start talking about your activity level. Usually patients are able to go back to an office type job between 2 and 4 weeks after surgery. Their sore throat's gotten better from the surgery, you know, their arm pain or neck pain is resolving, and you've really cut back on the pain medication at that point, so you're able to kind of start getting back to your normal life. And then usually with the artificial discs, patients heal up in about 6 to 8 weeks. You know, we won't tell you that you're completely done at 6 to 8 weeks, but you're ready to start being active and doing more strenuous things. With the fusions, we typically go a little bit slower because we want to make sure that bone is well on its way to healing before we put it under any stress.
Okay, and we do have a question from a viewer. Can you have cervical disc replacement if you've already had spinal fusion? This is from Karen.
So Karen, if you've already had a spot in your neck fused, the answer is probably not, okay? Now, that doesn't mean you can't have it at a different spot in your neck, either above or below where you had your fusion, but not at that same spot. That would be a pretty major surgery to go in and remove all that healed bone and everything that's already in there to try and recreate the anatomy and stuff. So if you've already had a fusion done at, say, your C5-6, I can't do another fusion. I can't do an artificial disc at C5-6. But it may be if you're still having pain, the problem isn't at C5-6. It may be, like we talked about earlier, is there something going on above or below where you had your fusion that's really giving you the pain now?
At some point down the road, would you recommend physical therapy or some type of rehab?
Yes, you know, we kind of play that by ear with people. So a lot of people, by the time they've come to see us, they've already done physical therapy trying to get better on their own, and a lot of times you've used up a lot of your visits and things. So we really kind of play it by ear after surgery. If you're feeling good and you're motivated and you want to do therapy and you can get back to doing things on your own, then I'm a great proponent of letting people do things on their own. If you're moving kind of slow, or you need somebody to give you a little push, or you really are kind of nervous about getting back into things, then I think therapy is a great idea. And certainly if you've got any weakness or a lot of limitations before surgery that just don't seem like they're going away as fast as we want afterwards, then we would certainly start physical therapy.
Okay. And we have another video. Could you describe what happens to your range of motion?
Sure. So if you were to take a normal spine that's never had anything done to it and put it through a range of motion, you'd write down those numbers. Then if you took and you fused one of those levels in that spine, you'd usually lose between 10 and 15% of your range of motion. So for every one you fuse, you lose about 10 or 15%. Now, what happens after fusion surgery is you lose that 10 or 15%, but you may not notice it, or at least notice it right away, especially if you're only having one level done. But the more levels you have done, the more parts you have problems with, then people start to notice that loss of range of motion. With an artificial disc, you don't lose that range of motion. The whole goal is to keep you moving. So really, we want to have people that they don't really feel it when they turn their head to back out the car, or they, turn their head to look at things and play and do sports and ride bikes and things like that.
I know you alluded to this earlier, but when could someone, say on average, return to resuming their normal activities?
Sure. So normal activity after the disc replacement, I would typically say, is in 6 to 8 weeks. Okay. So we would see you back in the office again and make sure everything's going okay, make sure we don't feel like you need any physical therapy, and then we would kind of turn you loose, and we would let you do things as you see fit. So start, working on your car, taking out the garbage, lifting those big bags of dog food, whatever it might be. Again, if it's a fusion procedure, we may keep you away from that another month or so longer, just so we're sure that that bone is healing well in there before we put it under any extra stress. But from a technical standpoint, the artificial disc is kind of ready to go from day one, because it doesn't have to heal. It is where it is, and so it's not going to move anymore. And so, in fact, we want things. It's not going to move, in that it's not going to come sliding out of place or do something we don't want it to do. We want things to move in there back and forth and twisting and turning to be able to move your head.
Okay, and we have another question. This is Debbie. I've had a spinal fusion and I still have pain. What are my options?
Okay, so if you still have a spinal fusion and you still have pain, then you should see a physician who should kind of start from the beginning and try and figure out what's giving you the pain and problems. Okay, so what's giving you pain and problems? Well, the first thing is that just having a fusion done, or any big surgery, even an artificial disc, can give you some level of pain and problems. So you don't have any trouble with your neck at all. But if I put an artificial disc in you tomorrow, you would tell me your neck feels different than it did before we did the surgery. Okay, so just having a big surgery on your neck or on your low back can change things in there for you. The whole goal of having a surgery is you want to make a good trade. You want to get rid of pain that's a 7 or 8 or a 9 and knock it down to a 2 or a 3. So the first option is my neck painful because that's just the way it is and I'm kind of stuck with it. Okay, I made that trade and now I'm stuck with it. But then the other question is, are there other things in my neck that still may be giving me pain? Is it some arthritis or degeneration of the disc above my fusion or below my fusion? Are there arthritic joints called the facet joints in the back of my neck that are giving me pain? Is it an alignment issue? There's a number of different things that we kind of go through when we see you in the office in kind of a stepwise fashion to figure all that out. And then for each one of those things, there may be different treatment options.
Okay. And do you know if most insurances cover this procedure?
Absolutely. I don't think there's anybody that really doesn't cover the artificial disc at this point. These have been on the market in one shape or form or another for about 10 years. And then really in the last 5 years, they've become much more popular as the literature's kind of come out more and more in favor of artificial discs. So more and more doctors are starting to put these in. Pretty much every insurance plan covers artificial disc replacement. Now, as with any other procedure, they have fine print and things that go along with that, of course, but I would say to you pretty much every insurance plan covers it at this point.
Okay, and another question is, how long has this been approved by FDA?
Different discs, each individual disc is kind of like a car. They're all cars, but there's different kind of cars. So there's discs, there's different kinds of discs. So each one has been on the market for different lengths of time. In general, they've been on the market for about 10 years. The device I'm using has been on the market for about 10 years, and the kind of the follow-up studies that you operate on people and then you follow them at 1 year and 5 years and 10 years to see how they're doing is what kind of convinced me to choose the product that I'm using now. And again, that's because it has really good, a good track record. So they've been on the market for about 10 plus years.
Okay. And now, could you describe a typical patient, someone who would need to come in to see you for this type of procedure?
Sure. So in general, before you come in and see an orthopedic surgeon, there should be a couple things going on. Either You've got really bad pain that you just can't live with anymore. So if it's a minor ache or a strain or something that bugs you, but it doesn't bug you too much, then leave it alone, okay? There's just some things we're stuck, you have to put up with. But if it gets to be a bad enough pain that it's starting to change your lifestyle, or you can't chase your kids or your grandkids, or you can't do your job, then that's something you need to see the doctor about. Obviously, if you've got weakness in your arm, or one arm is numb, or something like that, those are reasons too. Even if it doesn't hurt that much, come on in and see the doctor so we can figure out what's going on. Most people that come to see their spine surgeon are coming to see him for pain. Okay, there may be weakness, there may be numbness associated with it, but most people are coming in because they're having a lot of pain.
Okay. And we have another question from a viewer. This is from Ann. Can you do a disc replacement with multiple discs? An example would be a C7 to T1, replacing all those discs.
Well, okay, so the answer is you can put artificial discs in at 2 spots at a time in your neck. Okay, so if you've got a 5 and a 6 and a 6 and a 7, which I think is what you had, we can do both of those at the same time. They're not really approved by the FDA to put them in at 3 discs, okay, or 4 discs. And so the manufacturers and kind of the rule book says you're not supposed to do that. Now, for what you wrote down on your question, when you number the discs, they number the bone above and the bone below, and then the disc in between. So the C7T1 disc is 1 disc. It's 2 bones, but with 1 disc in between. So C7 and T1 would be 1 disc. C6 and C7 would be another disc. Okay. So again, we would want to, see you in the office and figure out what you needed to have done.
Okay, and we have another question from a viewer. This is from Jeff. How do I know what my neck pain level is? What would be an indicator that I need to get help?
Well, so a neck pain indicator. So does it stop you from doing the things you want to do? Play ball, chase kids, do your job, okay? Do you need to take medication for it? So if you have to take an occasional Tylenol or Advil, that's not that big a deal. But if you're taking, 10 Advil a day, or certainly if you're taking any sort of a pain medication on a regular basis, that is certainly neck pain that needs to be evaluated and treated.
Okay, well, I think this is a good time to transition over to Laura. I haven't forgot about you. Just wanted to introduce what type of, patient or what would bring someone in. So Laura, could you just briefly describe what was going on with you that you decided to come in to see Dr. Jacquemin?
Well, my situation, my pain came on quickly. It was January. I woke up one morning and I could not really even move to get out of bed, and just had tears running out of my eyes. And I finally made it out of bed, and I'm like, I had no idea what was going on. And I went and I got a massage that day because I thought, I pulled something, I strained something, and it seemed to help, and it just kind of went away. And I had about a good 3 weeks, and then the same thing happened in February, and it did not go away this time. And I thought it was my rotator cuff, so I put it off for a while before I went to see an orthopedic, and I think I went in about mid-March, and he said, it's not your rotator cuff, it's your neck. And so he referred me to Dr. Jacquemin, who I did check out extensively with a lot of medical friends that I have, and he came highly recommended, and I did my own research and got the thumbs up, and I'm very pleased. But by the time I had my surgery, and I know that he pushed it through, he scheduled me as soon as insurance approved me. I think he knew it was pretty severe. I'm a real estate agent, and so I'm used to going all the time, but by the time I had surgery, I had probably been living in my recliner for at least 3.5 weeks. And just to get up, to say even go to the restroom or to get a drink of water, it would take a good half hour for everything to settle down. And that was even being on narcotics and pain medicine. There really was no relief whatsoever. So it was a no-brainer for me because there was no quality of life to have it done. So I have no regrets whatsoever.
Well, how are you feeling now?
I feel great. I feel really good. back to doing the things that I love to do. I do put some restrictions on myself. I get out of mulching, and lifting heavy bags and things like that. I'll leave that up to my sons and my husband, but for the most part, I'm back to normal and have full mobility of my neck, and I couldn't be more pleased.
Okay, could you describe a little bit what that recovery was like?
Well, the recovery for me, and I will be honest, I am not the best patient, and I'm used to just going. And I think if I would have taken it easier early on, I would not have paid the price of having my recovery extended out longer than what it should have been. As Brian, your physician's assistant, said, I can tell you're an all-in kind of gal, Laura, but this is not an all-in kind of recovery. And so after that, I took his advice. But yeah, I think it was probably just a tad longer, but that was just due to me.
How would you describe the care that you received?
It was excellent. I mean, the whole staff at the office, top notch. And then with the surgery, I did spend the night. I did have pain afterwards, but I knew it was a success because the pain I had after was not the pain I had before. And the nurses and the staff there, they were on top of it. I never had to ask for anything. They just would come in periodically and keep me comfortable. Yeah.
What's one piece of advice would you give to someone who's contemplating this?
Number one, don't wait as long as I did to go see the doctor. And number two, I think if it's affecting your life and your work, just enjoyment of life, then you should put a pros and cons list together to have it done. And sometimes you don't even need the pros and cons list because I was in so much pain. I couldn't do anything. And I just wanted to get back to my family, my friends, and I love my job, so
Okay.
yeah.
Well, we do have another question, and this one is from another Laura. How long was the process from the first sign of pain to being pain-free? We're asking this a little bit different from the beginning.
So how long is the process from the first sign of pain to being pain-free? That's different for different people because even in Laura's situation, she woke up with bad pain one morning, but then it kind of went away for a few weeks. So it's like, where do you want to start the clock running, so to speak? Now, most people that herniate a disc, whether it's in your low back and your neck, we can get better without having to have a surgery. So the first time I see you, I don't necessarily try and sign you up for surgery. I want to make sure that you've had some medication, maybe a cortisone shot in the neck, maybe some physical therapy, and some other things to see if we can get this disc better without having to go through surgery. If you've already done all that stuff and then you come to see us in the office, well, you've already done those sorts of things. And you try and get people to go, if you can, for a month or two, if you can keep the pain under control before doing any surgery. Because again, most people get better in a couple months. So if you can control the pain with one of those other options and give the body time to get better on its own is really your goal.
Okay. And, sorry, it's the same question, but now Laura, from your perspective on answering that, from when you became pain-free from start to finish.
From start to finish, like when I first, well, and I can only speak for myself, my pain came on rapidly, and I had no inkling that I had a neck issue at all. I had a bicycle accident maybe like 8 years before, so we don't know if it's from that or if it's just degenerative due to age. But the pain stopped, like I said, maybe in about 4 to 5 days after I had a massage in January. And then it reared its ugly head about 3 weeks later, and it just would not stop. And by the time I had surgery in April, I had numbness in my fingers. The pain was radiating down the shoulder blade. You just couldn't get comfortable. I mean, it was just basically just crying all the time if I moved at all. And that's just not me. After the surgery, I was pain-free from the aspect, all of the other symptoms were gone. You just have some pain from the surgery itself, but that was very tolerable. And it was nothing compared to beforehand. And so I would say the pain after the initial surgery, that was gone in about a week for me. And I know it can vary because everybody's a little bit different. I think my discs, one was crushed and one was against a nerve, and everybody else is different. Because we didn't even try physical therapy or cortisone shots. I think you knew it was not very pretty.
You were pretty miserable. And it was pretty impressive on your MRI.
So.
Yeah.
So Dr. Jacquemin, does this sound typical?
Very, very typical. You know, one of the things that is different about what we do in spinal surgery compared to other orthopedic surgeries is that, you know, we try and make the spinal surgery your last resort. And so the problem is that these pains really, for a lot of people, are really bad pain or bad numbness or weakness, and they're really a life-changing problem. Okay, so if your knee bothers you a little bit, you can set up to get your knee scoped by one of my partners, and you know, then they'll get you into rehab and you'll be back to running. Well, that's one thing. That's not too bad going in. But for a neck like Laura's or a bad lumbar spine, you know, people are having trouble just working their job or taking care of their house, and it's really a life-changing problem. And so a lot of what I do sometimes, it's almost like being a counselor to explain to people that here's the process and here's what we're going to do, but this is not a quick jump in, jump out kind of thing like getting your knee done. Okay, lots of people had their knees scoped and they remember 20 years ago I did it and I was back to playing softball, you know, 2 months later. Back surgery, neck surgery is not like that. You heal up well, and we're getting people to heal up faster and faster, but it's a big deal, and it takes some time, and you have to kind of go through the process here. It's not a quick in and out kind of thing.
Well, I think you've answered my next question just from hearing you two talk. You know, how important was it for you to have this available at OrthoCincy, Orthopedics and Sports Medicine in St. Elizabeth?
Oh, I mean, I think it's very important. I mean, you know, again, it's been a couple of years since we did Laura's surgery, but you know, the artificial discs, there's more doctors in the country that are doing these now, and it's really, it just brings something to Northern Kentucky that we still don't have, that, you know, nobody else is doing this type of procedure here at St. Elizabeth right now. And so you can stay close to home and get your care right here.
So do you see this as a big change in spine surgery?
I do see it as a change, particularly for neck surgery. You know, again, it's not a completely brand new technique of doing things. We've done surgery on the neck for years and years. That's not really a change. It's just a different way of, you know, of dealing with the pain, dealing with that space once you're all done. So it's kind of an evolution. You've gone from, you know, things that where you would just, you know, go from a horse and buggy to a Model T to a sports car. Now it's the same sort of thing. We've gone from fusions from years ago where we took a big chunk of bone out of your hip and put it up into your neck, and now we don't have to do that. Then we've got artificial bone we can put in your neck, so you don't have to have that big cut down there. And now kind of the next step even, well, maybe you don't need to have a fusion, maybe we can put something in there that continues to move. So it's more of an evolution.
Okay, it's been fascinating sitting here and listening to you describe all this. In closing, I want to thank both you, Dr. Jacquemin, and you, Laura, for taking the time to come here today and help educate on this procedure. I do want to remind viewers that if you do have more questions, feel free to submit them on the comments section, and we will be answering those throughout the rest of the day. But at this time, I'd like to thank you, viewers, for tuning in, and you for being here as well.
Thank you.
Thanks, you're very welcome.